you might be thinking, I've done everything I can to take care of myself, yet I still got sick, and you're feeling really sick. I hear this quite often from people who come to see me and become my patients at the Michigan Center for Holistic Medicine, especially when they are afflicted with sometimes unrecognized conditions like Lyme or other vector-borne illnesses. First of all, sometimes we get sick even though we do really good things to ourselves to support prevention and healing. It's not your fault. And also, you should be congratulated for taking care of yourself because it made you better off no matter what. So it is important to be proactive because it does matter when you think about prevention and your health. But managing chronic illness can often be much more difficult when you look at some of the things that happen, like infection or environmental exposures, things that you had nothing to do with that have then created a chronic illness. And that's why I want to focus on longevity, chronic disease, and value of prevention in this episode 148. Hello and welcome to the Feel Better, Feel Great podcast and community. I'm Dr. Andrea McSwain, and today we're diving into chronic conditions and the value of prevention, and also looking at a very serious condition called Lyme, or vector-borne illnesses, how these long chronic infections can affect health, and what you can do to preserve your quality of life, because longevity is more than just living longer, it's also about living well. Please remember to like and subscribe. Hit the notification bell so you never miss an episode. And of course, realize that this is not just podcast, this is also community for Feel Better, Feel Great. And I really want to hear from you. I want to know how this helped you, or other questions or thoughts that you have, or if you'd like what information you'd like. So we are first working to get to that goal of 500 members or subscribers so that we can actually start surveying you in YouTube. That's exciting for me because it gives us a venue that we can really actually, really use as a nice infrastructure for a system. Okay, so your support means everything, and I want to get all that ingrained so that we can have the best community we can offer.
Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
This is a podcast. It's for educational purposes only. Please consult your doctor for personalized medical advice. However, and I probably shouldn't put that right after the disclaimer, but however, a lot of what I'm going to say today is what you wish you could hear from your primary. It's even what you wish you could hear from some specialists, right? Especially if you've gone to many doctors and been told that you're fine. That aggravates me beyond description. First of all, if you don't feel good, you do not feel good. You have a PhD in you, and it is the responsibility of a healthcare provider to believe you. And maybe I used to say that a little bit softer and nicer, but now it's very difficult for me sometimes to actually every time to hear my patients talk to me about how someone did not believe them. I had a patient once, and her family, she had a very close family member who was a doctor, and she was very sick. She was seeing me probably as the 10th or 11th doctor she'd seen in the last 6 or 7 years. She was young, she was smart, and she was sick. When she came to me, I knew she was sick. It was very obvious. We ran some labs, and I sat down with her and had to tell her that the labs that I found showed that she had a lot of medical conditions that we were going to have to address. When I sat down to tell her this, she said she had just seen a rheumatologist and everything was fine, is what she was told. And then she said, it's not fine. And then I proceeded with love and respect to say, you're right. There are a lot of things that are bad. Now we're going to be able to work on them, and I believe you're going to get better, and it's all going to make sense soon. But I do think you have some significant medical conditions that we need to address. And she started crying, like really crying. This is an extremely stoic human being. So to see her cry, I was like, oh man, I didn't deliver that right. And I really, I've hurt her feelings. It made me very sad. And, but then she said, I'm crying because you believe me and you found something that's wrong. And I'm crying because now it makes sense. And so there was a lot of relief there for her. In fact, to the point that she was crying from frustration. And a lot of women do that, and men do it too, but a lot of times women do it. They cry because they're frustrated, and that release for her brought her actually a lot of joy, and she got better. Okay, so she had some conditions that we'll talk about for infection, right? She had lived a good life. She had access to prevention. She did a lot of great things for herself. Very caring, compassionate, everyday lifestyle pillars were maintained for herself and her family. But she was very sick. And when people have these very sick, invisible battles, they're often discounted, marginalized, and left to deal with it on their own. And I think, why do doctors exist? Why do healthcare providers exist if we're not believing people enough to actually figure out what the problem is? Particularly with things like Lyme and infections. So Lyme is a very general category. I'm going to say Lyme repeatedly as I talk about this in this podcast. I want you to recognize I'm very well versed in what is Lyme, what are vector-borne illnesses, what are tick-borne illnesses, what are co-infections, what are overlapping and viral infections, advanced testing for those, advanced treatment for those. All that is going to be wrapped up into the word Lyme. So if you have Lyme, if you are seeing people for Lyme, if you are not getting answers for Lyme, just know that this is a very general conversation about having a chronic infection, recognizing symptoms that are like creating invisible battles for people so that people can start to recognize those. Now, if you already know that you're aware of Lyme, then I would encourage you to actually go to my website, micenterhm.com, and soon we'll have more information up on our website, but you can contact our office and look at our Lyme program because we have a lot to offer. And I want to provide people, though, with kind of this first step in understanding these things. So so I can kind of feel out the audience. Also, if you want to just comment in the section, ask questions more about Lyme, we can discuss that. But really, chronic diseases and chronic infections are often those invisible battles. They cause persistent inflammation. They wear down the immune system, right? You have some good days, you have some bad days. You sometimes don't know when you're going to have good days or bad days. Though, that you're getting worse, you don't have answers, and whatever you're doing is not working, and sometimes nobody will believe you. So, sometimes I think about the immune system as like bouncers or security guards in different venues, whatever. For example, like a concert. They get distracted, they get tired, and when they do that, then troublemakers can come. Troublemakers like infections, co-infections, sometimes cancer cells or cancer abnormal replication. And they get in, they cause chaos, and then the immune system is very occupied by this. Sometimes the immune system is very occupied by this, and it's then allows for other things to come in. But there is good news. Chronic illness is definitely something that we can look at reducing infectious loads. We can look at reversing as much as the illness as possible. And you can look at an improved quality of life, and you can look at longevity metrics. Okay. When you start going to a root cause approach with treating chronic disease and chronic infections, you actually start then looking at sustaining and improving longevity, right? And a lot of times too, people wonder, is preventive care worth it? Now, I've kind of just come to summarize that preventative care is the answer, is the treatment. Preventative care is the treatment. And a lot of times I say sometimes in the clinic that we biohack for the sick, right? So biohacking is a lot about finding those really particular aspects of the metabolism, immune system, how the body works with the mind, emotions, finding those keystone spots, right? Those little hack spots, those tricks, and then applying them for when people are sick so they get better faster. Well, prevention is the same thing. So a lot of times people think about preventative care is regular screenings. That's actually secondary prevention, right? It's a monitoring or an analytic testing of what is happening in the body, but it is not actually prevention. So getting a mammogram, for example, getting a colonoscopy, or maybe alternatively, getting a thermography or getting a Cologuard, these things are looking for problems, but they are not preventative care. They're labeled preventative care, and it's an absolute misnomer. What is preventative care? It's getting the sleep you need. It's eating whole foods, right? It's drinking quality water. It's moving in your body to keep your organs pumping and moving, right? This is prevention. It's also treatment. Now, for people who are looking at that from a cost perspective, cost breakdown is very interesting when you look at the cost of waiting versus acting early. When we know that cancer treatments can cost hundreds of thousands of dollars, even with insurance, there's out-of-pocket costs that add up to tens and tens of thousands of dollars. So, that is the waiting aspect, right? Well, I'll just see what happens. The active early, person is really looking at, okay, I know I need to keep these good habits up because they're going to help me no matter what comes ahead. And this is a perspective shift. Prevention isn't just an expense, right? Oh, well, if I get that magnesium and my bowels work better, that's just like, so I have less constipation. Well, if you have persistent constipation, then you're maintaining a lot of toxins in your body, and that puts you at higher risk for colon cancers and a lot of other cancers and immune problems. So is it a good idea to get those magnesium supplements? Is that an investment? So preventive care is often seen as like, well, is that necessary to, add something to my face so I don't get really dry and cracked in my skin over my sinuses, and then I get a sinus infection, which leads to bronchitis and then pneumonia, and then I'm in the hospital. That might sound overwhelming, but that's what I hear on a regular basis. So where would I put you? If you have pneumonia, reversing that. If you have bronchitis, reversing that. If you have upper airway problems, reversing that, supporting the immune system with prohistamines, and also creating improved skin barrier as a defense for your body. So you walk it back, right? But are those also the treatments for pneumonia? I think that's the conversation. If you're looking at it as prevention, then you're looking at it as maybe you never see the problem. And that is my ultimate goal in my practice. Really, no matter where anyone is, if they're going to the emergency room every week, our first goal is for them to not go to the emergency room. Okay? My first goal is not to resolve all of their problems. My first goal is to be the most immediate problem, back it up. Now they're not going to the emergency room. Okay, great. Let's make sure they're sleeping better. Okay, let's make sure they have more activity in their day that's supportive of their health. Let's back it up. Let's back it up. Let's back it up. Let's get them more productive days and more productive hours even, and build them up to make them stronger. And that to me is preventative care, but that to me is just care. What is specifically preventative care? I think it's a tagline for then saying like, I don't really need it. Preventative care is I'm getting these screenings. Okay, no, that's not prevention. Preventative care is I probably don't need it, but I'm going to do it anyway because no, it's just care, right? If you can take unfiltered cranberry juice with no sugar and definitely no xylitol, and you get some cranberry juice in, or cranberry pills, but cranberry juice an ounce a day, if you have recurrent chronic UTIs, you have a prevention that is then the treatment. What if you don't have urinary tract infections anymore? What if you don't have to take antibiotics for recurrent urinary tract infections because you have an ounce of cranberry juice a day? And there is some very good literature to say that urinary tract infections are prevented. There's really good literature to say that urinary tract infections are prevented with unfiltered cranberry juice, no sugar. But there's in the article I'm thinking about specifically, it says, but it doesn't treat urinary tract infections. And it's like, it's paradigm shifts, and I definitely live in a different paradigm shift because I think, hey, if you take cranberry juice and you don't have an infection, didn't we treat it? So that's where I would like to live, right? Not having the problems. As best as we can. So if you are just jumping into this episode, please subscribe to this channel. I post content once a week. Looking at that is very important for prevention. Also looking at this idea of one-size-fits-all medicine versus personalized care. And if you, for example, have Lyme, now Lyme is very pervasive. Lyme VBIs, which are vector-borne illnesses. So I'm going to say VBIs. Lyme VBIs, first of all, really awful one-size-fits-all medicine for Lyme is that it's only an acute infection. So I would say it's a massive misunderstanding that Lyme is only if you have a bullet, like a target size, and it's only a skin issue. Well, skin is your first line of defense. So if you have a rash that looks like a target, then you are allowed to have Lyme in the conventional community. Then you take an antibiotic because it's a potential infection, but only for a few days because it's not really an infection. It's just a place of entry, right? A tick. You got bit by a tick, and the tick has now introduced something that the body's reacting to, and so there's this bullseye target on your skin, kind of a rash, and you're like, okay, I have a rash, I'll take an antibiotic. So is it really an infection, right? So conventional medicine would say no, but just take doxycycline because that's what we're told to tell you. I will tell you there is one caveat that the Center for Disease Control says that neurologic Lyme can be treated with IV ceftriaxone. So there is some small acknowledgement that Lyme can actually become a chronic condition and be treated with an IV antibiotic if that chronic Lyme is now showing neurologic symptoms. But in general, the one-size-fits-all medicine for Lyme is you have to have a bullseye pattern of a rash, and then you take a limited number of antibiotics because it's not really an infection, it's more like an intrusion or a bite. So there's potential for infection, right? Okay, personalized care is recognizing that there are many stages for Lyme. Vector-borne illnesses can enter through many different vectors, not just a tick bite on the skin. And the symptomatology is everything. That's very hard to discern, but if you cannot get better, if you really hurt, if your brain hurts, if your body hurts, if your joints hurt, if your gut doesn't work, if your heart has POTS or some kind of bizarre tachycardia, if your liver feels full, if you're just sick, you've got to explore other avenues. And the estimation for Lyme is it's very small because, hey, if you give somebody doxy and they don't really have a rash, they have maybe a rash or maybe they don't have a rash, and you give them doxycycline for a few days, an antibiotic called doxycycline, that should be sufficient. And if everybody else comes in and they say they think they have Lyme and they feel really awful, they don't really have Lyme. Because if they didn't have a bite present, how could they get Lyme? Well, it's a vector-borne illness, and there's many vectors. So the idea is that if you're thinking about one-size-fits-all medicine, you fit people into a really small little container. And if you're thinking about personalized care, I'd say the really explanation of personalized care starts with a provider telling you or showing you, which is better, but sometimes hearing it's important too, the words, I believe you. Telling a patient that I believe them opens the door for them to tell me what is actually going on and for us to work together as a team. And that is personalized care, in my opinion. I'm sorry I have to tell people I believe you. I wish that they would already have that from every other provider that they meet. But when they come to me and I see that they're very, very sick and they've been ignored, they've had one-size-fits-all medicine, I create a line in the sand right away, which instead of saying, I don't believe you, or I've excluded all these things because you didn't fit them, I say, I believe you. And then they tell me what's going on. And then we look for these pieces of information, these insights. We do lab testing, and we start providing personalized care. Pretty cool. It doesn't mean that everybody has something that's dramatically different. Like what I do for you is dramatically different than what I do for you. The idea is it's really what you need, right? And so there's obviously overlaps. The body has an inherent design. It has a physiologic pattern, anatomical pattern that's repeated in all of us. And so I do look at that kind of general design, but then I also look at unique factors. So if there's genetics, lifestyle, health history, surgeries, I look through that lens. Like I said, if you have chronic urinary tract infections, I'm going to look through the lens of your place of vulnerability, right? So rather than the one-size-fits-all medicine approach where people are like, yeah, it's just your bladder. Let's say that. Or for Lyme, it's just your joints, right? Just your knee joint. Or if it's Lyme, whatever, it was just the skin. It was just that rash. It's like, well, why do I hurt now? Why did I lose 60 pounds? Why don't I want to eat? Why does it hurt to eat? Why is my mood so disrupted? No, that's depression. That's your bladder. That's your knee joint. Go see an orthopod. That's your blah, 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 blah. Like, well, I don't feel that's true if you're saying that as a patient. So it's like tailoring a suit. One size won't fit every person. And that's what you need to think about. So anyway, I wanted to talk about that. I really want you to see that if you are suffering, first of all, even if you put a lot of value into your care, right? You put a lot of value into prevention, if you will, or the work of lifestyle medicine, and you still have a chronic disease, you did not do that to yourself. It is not your fault. In fact, what I find is that when people actually take care of themselves, right, they're in a less severe state than if they did not take care of themselves. I have to also say as a caveat, when people have taken care of themselves and recognized the care that's necessary in the body with the lifestyle pillars of sleep, movement, food, what they're eating, stress and relationships, when they've addressed those 5 pillars on a regular basis, when something like chronic illness happens, they are much more equipped to handle the therapeutics that are warranted for that situation and get back on track. So sometimes they got to up their game a little bit to get taken care of and get those chronic situations dealt with so they can get back on track, back on the track that they set for themselves by valuing their care and valuing prevention. I want to encourage you to listen to the podcast. We have a guide to offer you to move forward, which is a free guide, Inflammation 101. So a simple 3-day plan to reduce pain, boost immunity, and improve your health. So that's like kind of the general level. If you have Lyme or a VBI and you are looking for a provider, I invite you to complete the form on our website, micenterhm.com. And then, of course, continue to look at how this podcast and our growing community is working to give you more resources to address prevention, to address care, and to address longevity. As I say all the time, we are in it together. Thank you so much. And again, please subscribe, please share, please hit the bell so you get the notifications. Have a beautiful day.